Joining us now, clinical nurse specialist Alice Benjamin. Thanks for joining us, Nurse Alice.
Thanks for having me.
We want to start with masking up even if you're vaccinated, which is the new policy in LA County. So what's the benefit here? You know, we hear a lot of people say, wait a second, if I had the vaccine, I'm supposed to be protected even from the variants.
Right. So we know that the vaccines are important and you should get vaccinated if you haven't already. But wearing masks is going to be part of that multi-pronged approach to slow the spread. And if you look at us here in Los Angeles County, only 52% of people are fully vaccinated. So we still have a good portion of people who are still at risk for getting coronavirus. And we have 1.3 million children who are not yet eligible for getting the vaccine. And for those who are vaccinated, the science is clear. If you look at Pfizer, 96% effective in preventing hospitalizations, 88% effective in preventing symptomatic infections, and 79% effective in preventing lab-confirmed infections. So this is all good information. So it really is a benefit for people to get vaccinated. But still, until we can get more people there, we all need to mask up.
Let's talk about children for a minute, because we heard that recommendation from the American Academy of Pediatrics about masking for them. How at risk are they? And is part of the idea to mask them up to prevent any spread that they might have, giving to their parents or grandparents?
Yeah, so we know that nationally, children make up about 16% of all COVID positive cases. And what we also know is that children, when they are infected with COVID, are often asymptomatic. And usually when someone's sick, you kind of stay away from them. But if you don't know that someone's sick, it's hard to do so. And so with children, it's going to be important that they mask up in school because, again, Carolyn, many of these children are not yet eligible for vaccines. And as well, it's very difficult to police between who's vaccinated and who's not vaccinated. So I'm really glad to see that the American Academy of Pediatrics released their COVID-19 guidance for schools, because this is going to really help direct and guide the public. I'm hopeful that all school districts take heed to this and that they encourage all adults and children on campuses to mask up.
And early on, when we didn't know as much about COVID, we were hearing a lot that, children aren't impacted that much by it. But certainly we know of cases where there can be a long-term impact from COVID for children who get it.
Yeah, so we're learning a lot about the long-term effects of COVID. And just like adults who can experience long-lasting fatigue, lung problems, joint pain, brain fog, and other symptoms, this can happen to children as well. We call this post-COVID in children. So what that may look like, if you're a parent wanting to know, this may look like your child struggling to make it through the day. They're exhausted. They're having troubles concentrating. Maybe their grades are a little lower than usual. Their performance just isn't what it used to be prior to getting COVID or getting sick, and they just feel off. So that's about as much as we know right now. Obviously, as we move forward, we'll learn more and we'll keep reporting and sharing that information. But, the best thing here, Carolyn, is to try to prevent it as much as possible. So I really encourage everyone to get vaccinated and to please wear your masks.
All right. Nurse Alice Benjamin, thanks again for your expertise. We appreciate it.
Thank you.